Hello, everybody. Welcome back to the podcast. Today, I am joined by the lovely Dr. Bar, who is absolutely fantastic when it comes to the topic of peptides, which we're going to discuss today. I know many of you have been asking for this and you're really eager, but in case you don't know who Dr. Bar is, Dr. Bar, Dr. Iman Bar, has been practicing since 1990. She began her postgraduate studies in hematology oncology, culminating in a fellowship specializing in stem cell therapy. In 2002, Dr. Bar pioneered the first concierge medical practice in Newport Beach. Newport Beach Concierge Medical is the title because I know some of you do live in California. Maybe you want to go check her out. So, her innovative practice, which we have spoke about, maybe expanding, is focused on personalized care and really helping people approach a full holistic approach to their health and healing their body. And part of that is the approach with peptides, which we're going to talk about today, Dr. Barr. So thank you for making the time for me at last.
Shamin, it's a pleasure. So nice to meet you finally in person. I believe we were on different podcasts or programs before, but we never met in person. So thank you for that opportunity. I'm so excited. I am so honored to be on your podcast, and I'm so amazed by your journey. So thank you so much for helping all these wonderful, souls that needed support and help. I really appreciate your journey. And thank you for having me on your program. Thank you for the introduction.
Oh, thank you. That's very sweet. Not
Thank you.
many of my guests will follow up on my story first before I interview them. So I am actually blushing here. You can't tell. But thank you, Dr. Barr. So I'm like really hoping we can just go deep on peptides today. I know it's your passion. It's booming now everywhere. It's just blown up over, let's say, the last 2 to 4 years. And people have a lot of questions. And some of the questions are just like the basics, like what are peptides? How do they work?
So peptides are not new. Contrary to everybody thinking that it's, oh my goodness, it's something that just occurred out of nowhere. Once celebrities and influencers start talking about them online or in their, social media, Kardashians, even Elon Musk talked about it to lose weight and so forth. And then it became like a big boom.
Mhm.
And I think in the 90s, before that, they were considered research products. But in the 90s, I get what happened is that the in the United States, the FDA decided they're just going to make it kind of a research product. So that create like an interesting gray zone where people started having them from everywhere. They're not classified as drugs. They're considered a research supplement, which means people should use them in a research lab.
Mm.
Um, and now people are receiving them online by going to, we call them the gray peptides. And unfortunately, they're not really certified for human use or even animal use.
Mhm.
But that created a flood in the market and people started buying them since other, celebrities started talking about it. So peptides are not foreign to our body. They are amino acids. Two or three amino acids linked together would be bioregulators, and maybe less than 50 amino acids. Everybody knows the amino acids. Amino acids are the little Lego blocks that put a protein together,
Mhm.
right? So the amino acids, when they're like less than 50, became peptides. More than 50 are the hormones, which people know about, right? So
Mhm.
if it's a protein hormone. So the 2 to 3 molecules are called bioregulators, which not many people are talking about that.
No.
They were researched over close to a century in Russia. The whole thing started. Dr. Kavanson during the Cold War, actually in the 60s, he had more research on those bioregulators because he had to find the secret teeny molecules that will save his army and bring them back
Make us
to,
super soldiers.
yeah, super soldiers, especially they were like, with the Cold War and radiation and all being in submarines for months. So all these soldiers come back and they're aging and they're sick and exposed to radiation. So what happened is that he had that money and funds from the government, and he started researching, and he stumbled on, he was a physician, but also went into the army. So the research was funded by the Russians, and he was able to find those little teeny molecules, two or three of them, that change the trajectory of longevity and anti-aging. So those aging soldiers become younger, healthier, and get back to their posts again.
Mm.
So he discovered, even like in the lab when he was trying those, the old mice that were there were mixed with the younger mice. They started having babies again, you know. So it affected fertility, affect longevity. They were obsessed by research. They thought the Americans are going to make them blind or something. So you had to conduct this research with some little teeny molecules bioregulators. Still, we're talking about that, that actually reverse the blindness. So a lot of these bioregulators save the immune system. So it's very interesting. They've done a lot of research really on humans because these soldiers, thousands and thousands, maybe million of them had it. And then after the war, he had the gerontology center, I think, in St. Petersburg,
Mhm.
and they started helping people for anti-aging, and a lot of people from Europe and university from Europe got into that. So bioregulators are the very teeny forms of molecules that are peptides, but they are smaller than peptides, in a sense, like a smaller form of peptides that they can get into the nucleus, that can get into a little message and reverse a lot of the DNA damage. Like they're more sensitive in a sense because they're small. They can go affect the pineal gland. And we know the pineal gland sets all your hormones, right?
Mhm.
So that was the origin of peptides, I would say, discovered in clinical studies on bioregulators.
Mhm.
Then the other stuff came to follow. Yeah,
That just sounds like too good to be true. Stuff like
interesting
that,
story.
because it almost seems as to an outsider that we're still clutching at straws, trying to find that fountain of youth. But maybe the Russians came across it like 70 years ago.
Yes, yes. And I think also, I might add, if you think the Swiss and previously, before that, even the Chinese, they used to eat organs. If you think about like adrenals, like the
Mhm.
kidney and adrenals, the believe it or not, the testicles, the heart. So these organs have also small molecules like peptides that trigger the cellular repair and helps healing. So I would say it even dates before the Russian. I think those organ kind of things, now they put them in capsules, have also peptides in them because they were used to reverse the aging and so forth. So they were eaten, and actually were used even like in longevity centers in Switzerland and places like that, from sheep or other animals, and they were used for reversing aging. So that is, I think, another source, and maybe we're talking about hundreds of years before that, that
Oh.
people have used organelles or organoids and stuff like that, or organs that actually have definitely some element of peptides in them.
There are some elements of history and health that sometimes I think, man, we're slow to catch up. Like our ancestors knew about this thousands of years, and now we're just claiming Eureka ourselves, but
Yeah.
they already knew this. There is aspects where like, okay, we're great at some things, but we're really slow at other things.
We're just barely like learning from our ancestors. You're right about that.
Mhm. So, um, with the peptides, they are natural to our body. Where do we make them in our body?
So peptides are made in every single organ and tissue. There are peptides that are made in our gut. You probably heard about BPC 157.
Mhm.
You probably heard about the dihexates made in the liver. There are peptides in the thymosin alpha and thymosin beta. So MOTS and SS31, that these are mitochondrial peptide. So these peptides were found in the brain, in the testicles, in the muscles. So research have discovered peptides over the years, and they are natural ingredients of our body. They are pleomorphic, meaning that they can do multiple functions, right? Even though BPC 157 was discovered in our gut secretions.
Mhm.
It is great for healing muscles. I use it a lot for fixing muscles, tendons, joint injuries, and also it's great anti-inflammatory. It has some neuroprotective effects that protects your brain. So even though it was produced in your gut,
Mhm.
it has multiple functions. That's why I'm calling it like plurotrophic. Versus the bioregulators, the very small one, were very specific.
Mhm.
So apitalin, for example, a bioregulator, some people heard about that. It regulates your circadian rhythm and your pineal gland. Only one specific thing, pineal gland. But BPC can have multiple functions. Even the GLPs, right? They are also secreted, but we don't make enough of them. Now, they were created in the lab pharmaceuticals. So most of these peptides are synthetic, right? They synthesize them, they put the amino acids together in the right sequence. So the GLPs, for example, people take them to lose weight. You're familiar with that one,
Mhm.
the GLPs?
Mhm.
So there's GLP-1, GLP-2, GLP-3. People have them on different names in every country, Ozempic and all that.
Yeah.
Trizepatide, Trutide, the new one. So these peptides have multiple functions. Even people took it to lose weight. It can help on insulin resistance, can help your fat metabolism. We're finding a lot of benefits in inflammation. So they affect different organs, and that's the beauty of peptides. They're not very limited in function, and that is why they are amazing with little side effects if you take the right dose, because they're micrograms. They're not like, large
Grams.
doses.
Yeah.
Yes, micrograms. And they're very short-lived. So that was the intention of our body to make it. A few amino acids go out, do a job quickly as a messenger, and get broken down and recycled.
Mhm.
So that's how they are made in our body, in every organ,
So the
with the
BP
different functions.
Yeah, the
Yes, go ahead.
BPC 157 is one of the more popular ones that we would see more commonly on Instagram posts or people kind of influencers talk about it, especially
Yeah.
in the fitness realm or powerlifting or strongman or stuff like that. They'll use BPC 157 a lot. Now that makes me think though, if it's primarily made in the stomach and digestive tract, does that mean if somebody has a lot of stomach and gut issues for whatever reason, that their production is going to be downregulated? They're not going to make enough of this peptide if they have issues.
That is a good question. It's secreted in the stomach. Actually, we use it for a lot of gut health, right? So as we age, actually, too, not only get sick, we produce less and less peptides, stem cells, immune cells, right? As we hormones, right? You know that you help a lot of people with hormones. So unfortunately, humans are not made to be invincible for millions of years. We decline as we go, and everything that is produced in our body is produced in less quantities. And when we're sick or not doing too well, of course, that is also shown in less production. So yes, I agree with you, but I guess I missed that the fact that actually BPC can heal a lot of the gut issues as well. So when people are having gut issues, it would be a good thing to take BPC as well. So it's been used for inflammatory bowel disease, heartburn, and gastric reflux. It's been used for inflammatory bowel conditions. Definitely, it's very helpful for the gut. And when we use it for the gut, we can take it orally because it was created in the gut and it's not broken down.
Yeah, so then it's not the only peptide that can be taken orally, is it? Like the majority of peptides we would ex I don't want to say expect, but a lot of people would perceive that they need to be injected directly into the pain point or the joint, but there are some that can be taken orally.
There's very few of them that could be taken orally. You know which ones are very safe to take orally and easy to escape the digestion or the breakdown by our gut acid.
Mhm.
So when we eat a piece of steak or a chicken, what happens to it? Our stomach releases an acid, and breaks the amino acids of a protein into smaller pieces
Hmm.
and gets it digested, send it off so that it could be used to make muscles or your bone, cartilage, whatever the job is. So that's why a lot of the peptides, since they're amino acids and proteins in smaller form, they are digested when you take them orally. I know there's a lot of companies and there's no regulations when people sell stuff online that say oral GLP, oral, MOTS. Most of the time, that's impossible to even reach your direct target organ because it's going to be broken down.
Hmm.
And you really need a huge amount of it most of the time in comparison if you gave the injection.
Hmm.
Very few of them, for example, Silank and CMAX, are ones we use for brain, for
Hmm.
cognition, for helping with ADHD, with focus, with depression. There's one of them, I call it like your natural Xanax, for people who want to go all natural. So when we do those two in a spray, for example, we bypass the acid. So it's a spray, nasal spray. When you do the nose, it just goes directly, through the passages here, cribriform plate, and it doesn't get broken down by the stomach. Another one that comes to mind is PT 141. Do you know it?
No, I don't.
This is a really cool one. You've heard about oxytocin, the
Yes,
love
I
hormone?
have. Yeah.
Okay, something
The
pretty
the
similar.
post-orgasm hormone.
Yes, the love hormone. So PT-141 is another small peptide or, kind of spray form that would work. And we usually give it to people who are interested in having like less stress when they're like having sex or anxiety or low libido. Also enhances the sexual desire and function and sensation. So it's really cool, especially people with psychological issues related to sexual problems. And it was actually FDA approved at some point for females who are having
So
like high.
originally it was only for men, but now it's approved for
No, it
women.
was originally for females
Oh,
who do not want to have sex post babies and stuff.
yeah.
So it is actually FDA approved for us so that we can get it and have more desire and libido.
Does it help men as well with
Yes.
libido and erection and enjoyment and all that?
Actually, it does help them more than it helps us because they get more also benefit from erections. We don't.
Well, it depends on how the erection is being used.
You're right. So maybe we benefit indirectly. Good point.
Well, that one really is interesting because especially regardless of post-baby, as women go through midlife and perimenopause, a big complaint is the libido aspect. And I attribute a lot of that is to, well, at this stage of your life, apart from the hormones, you're stressed and you're exhausted, and that's the last thing you want to do at the end of the day. So that is interesting that we now have another option.
And it's a spray. So it was created as an injection, but we know we can give it as a spray, sometimes sublingual. I like the spray better because when they make the sublingual, the pharmacy, compounding pharmacies, the heat might damage it, so like oxytocin. So I really love the spray because you don't have to get a shot.
Mm.
It's awesome.
Well,
Yeah.
tell me about, because this one, the name alone makes me curious. Tell me about the Wolverine peptide.
Okay, so you probably saw the movie.
Yeah, I did when he looked really good.
So it helps with the healing and repair and recovery. When somebody has an injury, they can come back and, be as good as new again. So BPC 157 is named the Wolverine, and we usually combine that with the TB4, thymosin beta. And if you remember, we were just talking about the thymus produces peptides. Thymosin beta is an amazing peptide like BPC, we were talking about it, that works on increasing the circulation, angiogenesis, we call that. And it's almost like a booster when you combine it to BPC 157, almost like a booster for it to improve its function for healing and repair.
Mhm.
So thymosin beta also is very important for the regenerative, like if you think of recovery, all your white cells and scavenger cells come and clean and all that. So reduces that form of inflammation and an injury. But then the BPC, for example, is really great for, I would say, cartilage, tendons, bones, ligaments, muscles,
Hmm.
anything that's injured, especially for sports or for somebody who fell or somebody's aging, osteoarthritis. I love to combine both, and we call them the Wolverine for that very specific purpose because it's just an amazing recovery combo.
So he must have upped his dose a lot because when he appeared in the recent Deadpool, I was like, man, he looks better than ever. So
Yeah, I think
what?
somebody was mentioning like the celebrities use a lot of peptides and we didn't know about it from before.
Yeah, it was their dirty little secret.
Yeah.
So, what about another peptide? I don't know much about this one, but I do get asked about it, and I don't even know if it's legit. It's called the glow peptide. What
Okay.
is that?
So I'm just going to address legitimacy because, like, all the peptides are really amino acids that your body makes, right? It's just how you take them and who gives them to you, depending on their source. So we got to be very careful with that. So that's the legitimacy is coming from, like, is it a clean source? Is
Mm,
it a pure form? Is it laced with a lot of heavy metals? Are you buying a bottle that has some powder that has nothing in it more than just powder of
mhm,
mannitol or whatever sugar they're selling from China? Because most of these are produced in China right now, right? We have very few pharmaceutical clinical studies, and we have compounding pharmacies that make them. So you can do it by a synthesizer. So the legitimacy is not because they're illegal,
mhm,
it's because there's a gray zone and you really have to watch for the source. Otherwise, from taking something that can heal you and repair you and is amazing,
mhm,
it can harm, damage, ends up being a toxin and destroy an organ. So
mhm,
this is where, you do detox. So if you test people for heavy metals, for example, it's very common to find these contaminated with heavy metals, right?
mhm,
Or bluntly, they're telling you online, don't use it. It's for research and not even for animal use. So this is, I'm clarifying the legitimacy. You need to get it from a physician or a proper source like a pharmaceutical compounding pharmacy that is clean, that is tested, that is, and people now say, oh, it's third party tested. Doesn't mean anything. You really need to get them from a proper source. Otherwise, legitimately, you can hurt yourself. So that's the clear. Now we go to the glow. A lot of times people now to simplify the name instead of saying BPC 157 again
mhm,
and JHKCU or copper. That's a big full, big mouthful.
mhm,
So people call it the glow.
mhm,
So it's easy to order it and talk about it on an Instagram or a TikTok. So the glow is BPC 157. See how common people are using it
mhm.
with a JHK copper peptide. And have you heard about the GHK copper
I
peptide
have,
before?
and you can get copper peptides in some really good face creams and moisturizers.
You nailed it. So copper peptides have been discovered quite a bit in the cosmetic industry, and we've had them in our facial cream, in our night cream, in so many of the things that they've used for anti-aging, and even copper peptides or GHK is used for hair recovery and repair and regeneration. There's
Mhm.
even the kind of rumor, but I think it's true that it helps you reverse your gray hair. Right?
Yeah, I've
Because
heard that
the
about copper
pigmentation.
in
Yeah.
itself. Yeah.
Yes. So I think the copper peptide has been known in the cosmetic industry for a very long time. It's been used topical. It's a very small peptide and it could penetrate the skin a little bit. However, when I use them, I like to use them maybe with red light therapy or something like that to drive it deeper. But that's where the glow came from, BPC and JHK. And most of the time, that's an injectable again, if you want to get the benefit. Because if you do the glow topical, BPC is not absorbed very well on the skin if it's a cream. However, we use the one that is injectable on people with burns.
Oh,
Amazing. And scars and injuries, yes.
how
But you need to have a
like
clean source. I'm sorry?
I was going to say, how old can the scar be, or does it need to be shortly after the injury was ensued?
Acute burns, you can put BPC on it if you have like a pure form of BPC, but also and TB4 because that would be would be the Wolverine, right? It's good for blood vessels. GHK is great for regenerating skin and hair. So you can add the three of them, but it's preferably when it's an a, recent injury because then you can heal actually without scarring.
Mhm,
We've done that for people. But also if it's like a few months old or so, you can actually microneedle it.
mhm, mhm.
Have you done microneedling?
A long, long time ago. It wouldn't be my first kind of go-to to do. There's so
Painful.
much stuff. I can't do everything. I was
No.
asking for myself because I have scars here from when I was scalded, as we say in Ireland, as a baby, and I have scars. They don't bother me now, but and I probably wouldn't go to the effort of trying to get rid of them. Like they're part of me. But I was just curious. But I am actually curious in another aspect of my own selfishness. You've read my story and I lost a lot of weight. And compared to other people, I don't have a lot of loose skin, but I have a little bit that bothers me a bit. Could peptides potentially help with something like that?
I think so. Your really good peptides for skin would be the JHK
Hmm.
copper peptides. The copper, if you inject it, it burns a little bit, but I think that is one of my favorite peptides for skin and hair. And of course, if you have a little bit of inflammation with it, you can add the BPC. But I totally love the GHK copper peptide. Again, you can try to microneedle it very lightly or roll it.
Mm.
You know, the derma roller.
Hmm. Yeah.
That is another way of actually getting it to go deeper a little bit in the skin. And I would try to do that maybe with some light therapy.
So would you inject directly at the source where you want to tighten, or can you just inject at the stomach and it'll tighten everything?
I would do microneedling because microneedling creates multiple pores.
Hmm.
To inject it in one spot, I usually use that for a joint or a very topical muscle or some injury that I want to inject in the area. But if we're talking about a little bit more loose muscle and we want to have a general good look for the skin, I would get a derma roller.
Hmm.
It's even better for, money for your buck versus just putting one or two or three injections. That will take it for a bigger area.
Hmm.
And then I would use red light. Even microneedling is known to cause tightening for the skin because you're creating a little bit of a mini trauma,
Hmm.
and that will stimulate cells to come over and
Hmm.
help the skin to get to closer together and build collagen.
Hmm.
And that's what you want to do. So I tell people a lot of times, if you lost a lot of weight, don't go through the thought of like, I need to go do surgery and a tummy tuck. First thing, you've lost a lot of fat.
Hmm.
Build up the muscle, have a six pack in that area that will take some space, and then do your other stuff, right? That helps the skin a little bit to get tightened. I
Hmm.
think that would be the better way than going under the knife.
Yeah.
And again, it's our body, we love it. I had babies too. I wouldn't do it any different. I had two babies, but you know what? We're not going to be 21 again with the same body.
Hmm.
But
Yeah,
we have
that's
to
primarily
enjoy.
the approach I've taken. I don't have a lot of loose skin. I've filled a lot of it out with muscle. I
Yes.
take a lot of collagen, antioxidants. I do red light. Like I do all the things, but there's a
Mm,
tiny bit under my arms
yeah.
that if I could tighten it up, and I've spoke about the surgery aspect on many podcasts. I'm not at the stage where I would be open to surgery. I just
Mm,
think that for me, the negatives outweigh the positives right
yeah.
now. Maybe when I'm
I agree.
older, we'll see. But by that stage, I'd hope to have fixed it myself. But let me give you a case study. This was brought to my attention by a
Mm,
client. She had a friend who was taking well, she said it was BPC 157 and the glow, so she separated them. And she sent me before and after pictures. So the before picture, this girl was very bloated. She didn't look defined at all. She didn't look lean. She didn't look muscular. And then in her after picture, which was maybe 4 or 6 weeks after, the bloating was gone down. She had a lot of definition around her stomach. She swears she didn't change anything else. It was just the peptides she started. What would have caused that to happen with her? I'm assuming some of it was the BPC helping with any gut bloating and issues she had would have been a start.
I would say yes. I would 100% think it's the BPC. I'm just concerned if she had the BPC and the glow, not knowing the glow has BPC as well. Because
Mm,
this is one thing that I tell people online. Please follow up with your doctor who knows, maybe a functional doc or somebody like that knows a little bit about peptides, because it's really hard. You can go and pick it up from online, not knowing that the glow has BPC as well. And then a lot of time people are just improvising with dosage. And
mm,
as I said, these are micrograms.
mhm,
So I've been on a lot of Reddit chats. I go a lot online and especially Reddit because there are a bit more of aggressive people out there taking extra doses. And then they come back and complain, well, now I'm like swollen. So if you take one of the peptides like the CGC epimornin, it will make you get swollen if you're taking too much of it, right? Because it's like a growth hormone and people don't realize that could be dangerous. And the same thing with BPC 157. I've never had a patient and I inject into the joints, I mean, with a little higher dose, but I've never exceeded the proper dosage.
mhm,
But if somebody goes in milligrams versus micrograms, they start having side effects or
mhm.
having problems. But I'm just hoping that she didn't take the Glow and BPC the same time. I think her results probably was from mostly the BPC.
Mm.
I would say that maybe her gut was not in good shape. And the gut is so important. The gut connection, it's our third brain.
Yeah.
And if your gut is not absorbing even nutrients, you will have issues. You will take the nutrients and not integrate them in anything, and you will be bloated and very unhealthy. So I think her journey was amazing, but again, I would make
Just
sure people
caution
just
her. Yeah.
checking caution,
Mm,
make sure that you are taking the right dose and talking to somebody who understands, or teaching yourself. But I mean, it took me years to learn a little bit about peptides, and I have a medical background,
mhm, mhm.
and you got to be careful.
Have you used peptides for something like any female issues like adenomyosis or endometriosis or anything? Do you see any benefit there for relieving the pain and discomfort?
Yeah, I know you use for them progesterone, right?
Yeah.
You tend to use progesterone, which is the amazing thing. So there are peptides for every single, system in your body. If they are not very well regulated, FSH and LH, and their cycle is not regulated. I mean, there are peptides that will regulate you, or bioregulators, the small ones
Mhm,
that are capsules, and they are actually available. They used to be only available in Russia, but those bioregulators, I'll be happy to share with you
mhm.
the link, and if I'll connect you with they're wonderful young Russian uh, guys I believe in New Jersey and New York now,
Yeah.
and they have Dr. Cavanson's formulas. So there are, I think it's called Ovulutin or something like that. They have, um, remember the mice that
Yeah.
were fertile and they reversed the aging of their systems. That would be a good one. And of course, BPC is my other good to go to for any inflammation, because there's a lot of inflammation there.
Hmm.
But regulating their hormones through bioregulators might be a safer one, and doing BPC, which could be taken orally for inflammation. So that is a good one that possibly can help with endometriosis.
You
Definitely.
mentioned the biregulator earlier in the conversation. I don't want to say it's apigenin, but it sounded like apigenin. And that one influences circadian rhythm. And circadian rhythm is a huge factor in hormonal dysregulation and disruptions.
Mhm.
I see this a lot in people who do night shift work.
Mhm.
Is that biregulator something you would recommend to help people who do night shift work regulate their circadian rhythm and thus everything else?
Yes, 100%. Epitalon is so important because actually they found that that can actually reverse the methylation damage and reverse the aging process. So that is the study that he's done on a big, huge number of workers in a factory, 3,000 workers, and he was giving them epitalon and thymolin. I think the name of it is thymolin. These two bioregulators reverse the aging. Those guys were able to sleep, reverse their metabolic instabilities, the sugar and overweight and the fat accumulation. I mean, that was such an amazing study. I did have a CME talk and I was able to get some of that research. He didn't publish too many things in English, but there were some things published, and that was an amazing one. So his biggest two bioregulators that if you regulate your pineal and circadian rhythm, it's all your hormones, epitalon, and I want to say volutin. They have very funny names. I'll share them with you because all of them like had different names.
Mhm.
Um, and then you can actually combine those two, the one with the thymus, because as we age, our thymus age and our immune system age, and that's the beginning of chronic disease, inflammaging, and chronic inflammation will end up into cancer and death. So that's the trajectory of people getting, old. Their
Mhm.
immune system gets weaker, inflammation, and cancers and death, unfortunately. So doing those two bioregulators are huge, and they've been like used since the 60s, last, decade.
Mm.
No,
I,
last century, sorry. Need more
I,
coffee, need more coffee.
what's in that coffee? I
Caffeine.
I really, really, really think inflammation is our one of our arch nemesis, and inflammation is the biggest driver of aging across the board, from the gray hair we mentioned to the
Yes.
bone degeneration. Just inflammation, if you can conquer that, that's half of the battle.
Mhm. So the hallmarks of aging, I wrote a book. I wrote a book about stem cells. I'm just going to grab it right now here. This one. So it's on Amazon for hardly anything. If you want to do Audible, there's a whole chapter on the hallmarks of aging. And one of the biggest ones is
Hmm.
inflammation. And one of the chapters, I just made it for people to be able to read and understand and do simple things to reduce that and understands when I wrote the book, which was last year, 12 hallmarks of aging, 13 hallmarks of aging. I think now we're 15.
Hmm.
So this, this is like progressing so fast.
Yeah.
Science is. And the reason I wrote it because I'm fascinated also with stem cells and I love stem cells. And I just wanted in that book to tell people you don't have to pay thousands of dollars and buy stem cells from somebody, you can actually utilize your own and protect your own and nurture your own stem cells because it is your most amazing gift from God. It's your natural pharmacy. And
Hmm.
as long as we're alive, we have stem cells. So we just need to treat them well, right?
Hmm.
We treat our skin, we treat our hair. You know what I mean? We
Yeah.
need to think about our stem cells as the most precious thing that will heal and repair us. So that's why I wrote that book. And there's a whole chapter talking about inflammation and how to reduce that.
One
Biohackers.
of the easiest ways, people, to support your stem cells is to prioritize your sleep. Do not stay up watching Netflix, for God's sake.
Yes. Hydration, sleep, the simple things, eating healthy food, avoiding toxins, right? And then choosing the things that you put in your body, the food that you choose. So eating in diverse color, all your micronutrients, maybe intermittent fasting, but eating enough protein
Hmm.
because intermittent fasting can help autophagy, but some people do it wrong. They just completely starve themselves, which is not good. They need to have enough proteins and enough vegetables and fruits. Um, so all these basic things, whether you're in a hot sauna or even a hot, kind of shower, and then a cold shower after that, that stimulates things in your body. And taking simple supplements like respecting your vitamins, your vitamin D, all these simple things that you can do that actually restores your kind of like natural healing powers, rest,
Hmm.
right?
Hmm.
Yeah.
Your natural Wolverine genes.
Yes.
I've heard you discuss KPV for back pain and
Yes.
TB4 for autoimmune issues like Hashimoto's. Can you touch on that real quick? Because these are common issues.
Yes. So back pain is a really very common problem that we see once we hit a certain age. We're always sitting, we're more sedentary. We try to go to the gym and just maybe hurt ourselves lifting. But, it's the sitting and the type of lifestyle. We're driving, we're in planes, So humans are not made to sit.
Hmm.
And as we age, we're just constantly compressing and hurting our spines.
Hmm.
Unfortunately, also, like our bone becomes degraded a little bit, our ligaments and tendons and all that. So I researched and researched. One of the things that I really love, and there's a lot of work on KPV and inflammation. A lot of it also for the gut. So if you take it and you have some gut issues, KPV is great for inflammation, for bone, and it helps also with the pain that comes with the spine problems. So I usually use KPV for my bone back issues. I use KPV with BPC 157 again and TB4. This trio is amazing. I usually use those. And then sometimes I inject them in the area that hurts because then it's more concentrated. I
Hmm.
have a little ultrasound and I know where I'm injecting. And I know a little bit about anatomy, 30 some years. And so I can do that because I'm surprised some people now are injecting themselves. It's like, oh my God, I was on Reddit and somebody's like, oh, I injected my arm, dude. It's fine. Do it. Like, no,
Yeah.
somebody injected their elbow. But anyway,
Oh,
um,
oof.
I know, like you can hit a nerve. But anyway,
Yeah, but like
exactly.
it's like when you hit your funny bone, if you do that wrong, that's going to be very painful.
Yeah, especially if you inject your nerve, that's kind of could be damaging.
Yeah.
But anyway, I inject it in the area. I do use a little bit of an ultrasound. And then I put them on. I do have a class 4 laser or red light if somebody, can do that as well. But if somebody wants to combine it as like subcutaneous, normally if you cannot have anybody injected in the area, I would say take them as mini teeny injections in the belly, subcutaneous. It will go everywhere, right?
Hmm.
So you need to be consistent, maybe use it every day. And that probably would be kind of a replacement than injecting in an area, do red light. And it's amazing for back pain, amazing for us, like bulging disc, herniated disc, tension with the muscles on either, side, anything with nerve, anything with bone compression. And then you asked me the other one. So the other one was which
Was
one you asked?
TB4 for Hashimoto's autoimmune issues.
Oh, okay. So our thymus gland is a
Hmm.
very important gland that we have here when we are young. Um, we're not even born with it. It starts showing up as we are babies, and then it becomes rudimentary at 30. Why? Because God thought that we don't need to have build up for our immune system anymore. We've been exposed to most of the infections or whatever. And I think that's the time where we are meant to decline
Hmm.
gradually, right? That's unfortunate thing. So your TB4, thymosin alpha, these are two peptides that are identified in the thymus gland. And I love TB4 because it immune modulates, and I've used it in a lot of the autoimmune conditions. It is great for reducing inflammation, works on your macrophages, works on the cytotoxic cells, works on your angiogenesis, right? Because we said like when we want to heal, we want to bring the circulation, the blood vessels in the area. So I've used TB4 for people with allergies or autoimmune diseases. And sometimes I've even used it for infections, depend. So there are three other peptides. I'm just going to throw them out there. Three peptides that we use for infection. I've used them a lot during COVID, believe it or not. I used, and now I can say that freely, right? Before that, I would be in prison. Thymosin alpha. I've done thymosin alpha, TB4, T1 alpha,
Okay.
TB4, which is the both from the thymus, and LL37. So not many people hear about that one, but
Hmm.
LL37 is another small peptide that actually is antiviral, antibacterial,
Hmm.
antifungus. anti-mold.
So
So it's
potentially beneficial for someone that has Epstein-Barr virus as well, which that
you got
chronic
it.
immune response.
Yeah, so I have my little recipe for that because these are unfortunately viruses that live dormant in our body, right? We get them when we're, you know, one phase of our life, and then they go in and hide,
Hmm.
unfortunately, for years. So EBV and CMV. And that's the reason why there is a study that people either age faster, which is a problem. Also, the HSV, herpes, is another virus that comes and goes with the sun or for the stress or whatever.
Hmm.
So these viruses get activated. They got activated a lot when people got COVID, by the way. So COVID activated those viruses. So we used to check the titers and try to treat them. And unfortunately, these also viruses can cause lymphoma or malignancies.
Mm.
So people would get lymphoma down the road years later and do not know that that was a relationship and they could have cleaned up their chronic viruses, right?
And
Like
part of
people
that
know
is
about
back,
parasites, but they
yeah.
don't think about chronic viral infections.
Yeah, part of that is back to what we were saying. There's a huge inflammatory factor with these viruses, and you don't take care of your inflammation, you're a higher risk for some sort of cancer down the line,
Yes.
unfortunately.
Yes.
Whew. We don't want to end it on that sad note. So,
No, we want to have on a good, better so one.
you'd mentioned, you kind of alluded a few times, and I did want to ask you this about timing. Your dosages of peptides, do certain peptides need to be cycled? How does that work? But also, I'll throw this in as well. When someone starts to use peptides, how soon can they notice a difference or feel an improvement?
Okay, that's an amazing, complex question. So we're going to go with the first one. 100%, our body doesn't like to have the same thing every day exactly. So
Mm-hmm.
if you think about, we talked about circadian rhythm, right? You don't make melatonin in the morning, you make it at night, but you do cortisol in the morning, which we need it in the morning, but we don't need it at night because we won't sleep. We need it to rise and go to work. So there's something called circadian rhythm. Same thing for females. We do not want our estrogen to be high the whole cycle, and progesterone only rises later. That's why we have the periods and ovulation. Otherwise, we'll be just blah like everybody else, like a man. So with a higher dose of testosterone, a low dose of testosterone, high estrogen. So basically, that circadian cycling thing is what our body is used to. So whenever you use something, you want to respect that. When I do bioidentical hormone treatment for females, I respect the cycle. If I do testosterone for men, I don't give them one big dose that lasts them the whole week. I actually give them pulsatile dose every other day that's slowly released from the fat cells. If we do a little injection in the fat, then it slowly release peaks and go down. Almost similar, not exactly that what your body does. So I like to respect that also with peptide, especially some of them as kisspeptin or gonadorelin, the ones that work with fertility or with sexual hormones. You really don't want to have them every day because there's something called like you get sensitized to it. Number one, you can create antibodies to it. And also you become like you get it and the receptor doesn't work anymore.
You're
Okay,
adapting. Yeah. Yeah.
exactly. I just want to use a simple term. So now your receptor is constantly stimulated, and you don't want to do that. You want to free the receptor so when you get it again, the receptor can work.
Hmm.
So that is the reason why we cycle things. So especially CGC, epimorelin, and HGH, same thing, growth hormone, you need to pulsate it, right? We take it at night, we take it for a short period, and then we switch it to another peptide, kisspeptin or tesamorelin, or we just always cycle different peptides every month. Usually I have my patients are on 3 or 4 peptides a month. And then next month they would have another variation.
Okay.
Same thing with the bioregulators, because it can get expensive. And that's how he did it, actually. That's how he did that. So you would take 2 bioregulators this month, and then you stop, and then you take 2 others next month, and you go back again. So it's almost taking them the whole year, but you're taking maybe 6 months out of the year, 2 of each peptides, right?
Mm-hmm.
Or bioregulators. That way, your body is optimized on receiving them and you get the best physiologic. So that's why people cycle. Your other one, your second question was, sorry, I keep on
How
losing my.
soon can people expect to reap the rewards?
Okay, so that is variable between each peptide and another. If I give somebody a mitochondrial peptide, MOTS SC and SS31, for example, if they take that peptide that day, they will have energy, they will feel great, especially if they're on the low side. But if you take, for example, peptides like BPC 157, when I inject it in a joint, sometimes they say, oh, I feel great right now.
Hmm.
But when they take it in the belly, it might take about a week for them to see the results. So each peptide is going to be different and depends on how you're taking it too.
Mm-hmm.
So again, most of the results are not um, instant. And actually, most of the effects are not very long acting. Are you with me on that?
Hmm. Hmm.
Because they're little teeny amino acids. Their job was to signal, and that's why we have to take them every day, sometimes twice a day.
Hmm.
Yeah.
Okay, I feel like we would be remiss before I let you go to not just touch a little bit more on the GLPs. We mentioned it at the start, and not too much, just very, very, very popular now and almost given out like candy, at least here in Canada for sure. And I'm sure there's a pharmaceutical influence there. What are your, I don't want to say what do you love because I know you love all peptides. What are your hopes with these GLPs and how people are going to use them and how they're going to kind of evolve the industry going forward?
I think education is key. I love those peptides. Don't get me wrong, that a lot of people are trashing them because, oh, now you're having a saggy face and your saggy butt. And if they are taken wrong, you are losing weight, but you're losing, and this is the key point. I would like everybody to remember that because they're abundantly available everywhere. But if you take them and you lose the weight and get excited, you have to be measuring what is your fat mass, what is your lean body mass, do some labs to see your protein percentage and albumin, and make sure your sugar is well controlled. Because if you lose 10 pounds and you're excited, they could be muscle, bone, and immune bodies, something to keep you healthy.
Hmm.
And not all of it is fat. Fat is very light. So when I put anybody on these, we do those biometrics, we measure. Nobody comes and just gets it and leave because we need to make sure we know how much the percentage of fat, how much is their lean body and start, how much are their like protein percentage in the blood, what is their blood level for insulin and sugar, because I need to know that.
Hmm.
And once we get them started, I never send them home without a very strict diet saying you're going to lose your appetite. You're going to
Hmm.
eat protein. If you don't want to have anything all day, it's going to be an egg or a chicken with some vegetables
Hmm.
or the bone broth. I love the bone broth because if they don't want to eat anything, it's so easy to drink it. You have collagen and you have protein. So I
Hmm.
use it instead of water,
Hmm.
really.
Yeah. And it doesn't
So,
take up a lot of space when the gastric emptying has slowed down. It's easier on
yes.
them.
So it's so critical to make sure you're replacing your loss with the proper nutrients. Otherwise, you get sick.
Hmm.
And you'll be happy you lose 10, 20 pounds, but they are vital tissues that you've lost. And once you stop that peptide, you will actually
Hmm.
get sick. It might not be next day, but it might be a month later. Now you lost your bone, you can have a fracture. Now somebody has lost their immune system, they get sicker constantly. Now they lost their muscle mass, which is our savings in the bank.
Hmm.
Sarcopenia is huge. That's the aging. Everybody who has enough muscles will live healthier and longer. So, because of all the metabolic benefits of it. So, I tell people if you're going to do it, I love it. It is one of the best things ever that has changed. It's going to ruin the junk food industry. I think they're so mad. Nobody's eating like the cupcakes and the cookies and the chocolates and and all the candy as much and the pizzas and the French fries. You eat it,
But
you want to get
nobody can bloody afford to eat it anymore. It's so
yes, you eat it, you want to
expensive.
get sick, right? It makes you feel like so it has changed. People will be skinnier.
Mm,
but I want them to be skinny or healthy.
mm,
And most of the people that have been on it, I would say they should be monitored, measure their protein, and eat enough protein. But as they wean off it, they can be on a very low dose. We call
mm,
it maintenance. A lot of, or people can start just on maintenance, low dose,
mm,
and maintain that. That way, they are always going to be healthy, reduce their weight loss slowly, but at the same time, it's anti-inflammatory, it's protective. They're finding a lot of clinical studies that's good for kidney, heart, so forth. But you need to do it right.
mm.
So I love it. It's like the double sword, kind of
Double-edged sword, yeah.
weapon. Yes.
So
I hope you
you're
think about the same. What is that your thoughts on it?
Yeah, so my concerns are the same as yours. There are benefits, but my concern is that catabolism and the catabolism across the body, not just eating your muscle, which is where the conversation is. I've always had a concern that when people start using these and they're severely becoming malnourished and under eating, because let's be honest, me and you've worked in the health industry for a long time. Not everybody is doing what we're telling them to do. They're not doing what they should. We'd like them to eat protein and lift weights, but they're just not doing it. So then that's where that catabolism comes in. And then my biggest concern is the thyroid issue, that if they are malnutritioned, damaging the thyroid is something that's very hard to come back from. Even though
Yeah.
certain circles say it's easy to recover, it's not as easy as you would think. But I will
Mhm.
add in, I do work with a lot of people that are using these GLPs. They're very popular here, and they come to me primarily to help fill in the nutrition gaps. And you'll
Yes.
find this cute, interesting. I have a term for a specific food group that I use called fairy dust with my
Yeah.
clients, and I encourage them to put fairy dust on everything. So it's a way to increase their nutrition, but really easy. It doesn't have a lot of mass, so it's not taking up a lot of room in their stomach, but I'm at least guaranteeing they're getting extra nutrients, minerals, enzymes, polyphenols, just in a really simple way. And that's why I called it fairy dust. So it was just the idea of sprinkling it on. You don't have to be Gordon Ramsay or anything. So it's important, the nutrition aspect. It doesn't have to be bulk, it doesn't have to be a load of sweet potatoes and steak. There are other ways we can do it. Do you still have me?
I love I do. The internet slowed down a little bit, but I
Yeah.
think that's super. Is that the powder you have? Like, is it
No, no,
the
it's a protocol I teach. It's a whole
oh, I see.
protocol. But
Okay. I love
last question, because I know you have to go. Um, is there any upcoming peptides or research that you're excited about that's on its way out?
So you're asking about new peptides.
Is there anything that you see coming down the pipeline that you're excited about?
I think a lot of the peptides are getting clinical research. So some pharmaceutical companies are going to use these. That's why some of them are being taken off the market. But the ones that I'm very interested in are the ones that actually now work on brain health. And I'm hoping that we can get more advanced in that because, again, brain health is not as commonly thought about. People lose weight or just build muscle and stuff like that. But our brain is so important. And I think there are teeny peptides and bioregulators that are going to be amazing if they are utilized or become more available online or to the public, because that is so important to keep our brain health, intact. And we don't do as much of this. Like your dihexa, your again, your epitalon is so important because it's sleeping. It helps you with melatonin, sleep is so key, and Selenk and CMAX. I'm sorry if the internet is like going in
It's
and
okay.
out.
No, it's okay. It's okay. So, Dr. Barr, we
Okay.
covered a lot here. A lot. Where can people find you? Because
Yes.
you're a hard woman to get a hold of.
No, it's not. I'm sorry. I just don't check emails. That's my problem. And you can always reach me on the phone or text me. And I'm always on my YouTube. I always check my messages on YouTube more than my email. It's
Ugh. It
interesting.
was the one
So
place
I
I
like my
didn't
YouTube
reach you.
channel. I'm always on it in the morning.
Well,
And
I'll
I
link.
apologize for the delay.
That's okay. I'm Irish. We like to wind people up all the time. If anyone's going to call
Oh,
you out on your actions, it'll be us. So I'll
oh,
put
I love
links to
it.
everything because I have all of your links and your book.
Thank
I'm
you.
very, very intrigued in this biregulator conversation. You'll have to send me more information on that and see maybe we can work together or something and getting these accessible for my people because um, I see a lot of potential. And if the Russians are interested in it, I'm interested in it. So, Dr. Barr, thank you for your time today. This was an absolute pleasure. Hopefully, have you back on soon. And I just can't get over how much knowledge you have. So, thank you for your time.